What's going on, guys? Welcome to the circus, and today I'm sad to report that cancel culture has come for the good Dr. Scott Jenson. And today we're going to listen to his plea that he put out on his own channel, and I may interrupt a little bit, but of course I'll include links to everything down below in the comments section, so you can go and listen to it straight from him. But anyways, guys, let's get into it.
Dr. Scott Jenson. I represent Carver County. This is one of the most important videos I've made, and one of the hardest. Frankly, it's been a very difficult decision to make whether I even wanted to do it. Less than a week ago, I was notified by the Board of Medical Practice in Minnesota that I was being investigated because of public statements I'd made. They listed two allegations. They said I've been spreading misinformation in regards to the completion of death certificates on a news program, which happened to take place on April 7th. And you could find that one. It was with Chris Berg if you wanted to.
You've seen it before, but let's go ahead and check it out.
A doctor and state senator from Minnesota, Scott Jenson, joins us tonight on the 702 communication line to talk about an interesting piece you put in the Star Tribune recently as well. So I don't know if you like Dr. Jensen, Senator Jensen, but thank you so much for joining us tonight, sir. And let's start with this. You and I communicated briefly yesterday via email, shortly on the phone. Have you yet seen the information that's going into these U of M models that the governor is using to make these decisions?
And it seems to me, the more I think about it, that it could have been the questioning of the modeling that got the good doctor in trouble more than anything.
No, we have not. We have asked for those, and we were told by the governor's office that we would receive the data tonight. And so we're hoping to see what the assumptions are and what the data is. But at this point in time, we have not.
So I just want to be clear for our audience, sir. You've got a governor of a state that is making executive orders, stay-at-home orders, that right now is cratering your economy. We don't know what data is being used, and yet you as a state senator, as a doctor, have not seen that data that's being used for our governor to make these decisions.
No, we have not. And
does that not concern you? I mean, shouldn't the people of Minnesota be screaming right now?
Well, I think, Minnesota nice. We want to be good soldiers in that, but I think that people are starting to say, hold it now. We need to have a deeper understanding of this, and we're not getting it. I think that, in Minnesota, as a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics Agency in terms of how to do a death certificate. But basically, I felt like they were saying, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19. So
Wait. Sir, I don't mean to interrupt you, but that and what you just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I'd printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright?
Yeah, the modeling again.
Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough. And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
Senator, if you don't mind, after this interview, if you can send me that 7-page document, and just for clarity, you were sent a 7-page document by who again?
The Department of Health.
Department of Health, saying, hey, fill this out, whether they test positive for COVID. That is stunning, sir. So Governor Walz had his conference call today. One of the things he mentioned is he's going to lay out, it sounds like, some ideas or a plan tomorrow about his statewide stay-at-home order. It was supposed to end on April 10th. He is going to have some changes to that. Do you have any new information regarding that, sir?
I don't, but there's certainly been a big push that we should be using more of a laser-focused approach rather than some sort of a broad-scale whack-a-mole kind of a thing. We've got landscapers and lawn preparers, and we've got dock workers and golf courses, and there's no reason to not let those people out there doing their job. And it isn't just about those occupations I mentioned. We're also talking about a tremendously revved up allergy season if we don't do these things. If we just let the weeds and the spring pollens go crazy, we're going to have a lot of kids with hay fever and asthma. And we know that the supply chain of asthmatic inhalers is potentially at risk. So we have to be very thoughtful when we do these things.
Doc, I got 2 more things for you, sir. Since you are a doctor, I think the people at home, because you just mentioned the fear factor, there's a lot of trepidation. There's so much uncertainty right now. As a doctor, as a state senator, and you look out to the horizon, there's a lot of varying information about when you guys are going to sort of get on the other side of this. I'm not asking you to make a certain prediction, but what's your best guess?
Well, I think it's going to be the end of April, but I think when we get there, I think it's going to be manageable. Our hospitals have done a wonderful job of preparing for it. And the fact of the matter is, we're not going to win this battle by kicking the can down the road. At some level, we're going to win this battle by having enough people become immune to it, by getting the disease. And it's a mild disease in 90% of the people.
And he's telling the truth here. The reality is that it's going to move through the population. Containment's not going to happen, and it's not the end of the world because it's not a fatal disease for the majority of the population. Just telling the truth.
So the idea of minimizing this wave of the pandemic so that the next wave in the fall of the year will be greater, that doesn't necessarily make a ton of sense either.
Yeah, Doc, last question. I got about 60 seconds, sir. We'd love to have you back, but I actually originally brought you on because I thought you had a fascinating piece in the Star Tribune. If we can bring this up, Christy, but it says, hey, more thoughtful lockdown rules could spare loss and suffering. It was really geared towards, look, guys, we've got to obviously put public health first, but also be concerned about our economy. 30 seconds, sir. Why should people go read this piece?
Well, I think what it does is it says, listen, we're not going to have government make arbitrary decisions about what is an essential and a non-essential business. We're talking about measuring what we're trying to do. We're trying to provide some separation. We're trying to provide some social distancing. And if that's the case, we need to look at what's a safe occupation and what's not. So if 2 people are mowing a lawn on a golf course and they're 30 yards apart, that's not an issue. If we've got lawn people and they're working in solo or 2-man crews, this is not an issue. When government goes overboard, we lose our liberties, and we may never get them back. So
when government goes overboard, we lose our liberties, and we may never get them back. It's starting to become obvious why they targeted this guy.
We need to be very careful. We can do it with a more laser precision rather than just whack-a-mole.
Doctor and Minnesota State Senator Scott Jenson, thank you so much for the time, Nancy Boy. I think you...
Wait, did he just say Nancy Boy? What is that?
So much for the time, Nancy Boy. I think you made some major breaking news today, sir. And if you would, again, please email me that document, okay?
I will do that.
Thank you very much.
And the other allegation was that I provided reckless advice in my willingness to compare COVID-19 and the flu. When I got this letter, I was ticked. And quite frankly, I leaned into comfort and wisdom of my family to help them, let them talk me off the cliff. But doggone it, if this can happen to me, my view is it could happen to anybody.
The look of shock on people's faces that have finally been confronted with cancel culture never ceases to amaze me. But he said something here that we're supposed to pay attention to historically. I never thought that they would come for me. Well, they have. They've come for the doctors.
I mean, I've been a family doc for 40 years. I work hard. I love my patients. I do house calls. I've been medical director. I've held staff positions in hospitals to help make things work better. I've been in the Senate for 4 years and I've learned a lot. I've never had anything like this happen. Shoot 'em out. 5 years ago, I was named the Minnesota Family Doctor of the Year.
Minnesota Doctor of the Year, we ought to be able to dig up some video or something about that. Let's see what we got here.
That's good.
Just 40 miles west of the Twin Cities, along the South Fork of the Crow River, sits the charming little community of Watertown. Here along the main drag, Dr. Scott Jenson built a medical clinic some 15 years ago, naming it Catalyst. By definition, this means a person or event that quickly causes change or action.
You can't contain Scott. He's a little bit a powder keg in terms of just his presence. He's just everywhere. Years of ministry, I have been interrogated 2 times, once by Scott Jenson.
Joel Johnson, a patient and Dr. Jenson's pastor, will always remember the day they met.
I figured if he's this thorough in making a decision about the church, I can only imagine the kind of doctor he would be.
My wife is the best thing that's happened to me. She's the love of my life.
He met his wife Mary, who's a veterinarian, in college.
And his first words to me are, "Oh, are you oxidizing an aldehyde into a ketone?"
He is my dad's physician, my mom's physician, and my grandmother's physician.
Liz Neaton was introduced to Dr. Jenson at 8 years old. He provided support and guidance as she battled an eating disorder.
And I would come to him, and he was tireless in getting me treatment.
She also credits him with saving her father's life. Dr. Jenson noticed that her dad's heart rhythm was off and sent him to the ER. His widowmaker artery was almost closed.
He probably would have had a massive heart attack within 24 hours. If it wasn't for him, I would be sitting here without a dad.
According to Dr. Jenson, that's the magic of the doctor-patient relationship.
It's the patient that's out there fighting the fight in the arena of life. But I want them to know that I'm their advocate.
On the flip side, he says the physician needs to know there is an element of trust.
Because that trust is what drives me to see the next patient and do the best job I can.
He's concerned about my spiritual well-being, my emotional well-being, so he really, I think, takes a holistic approach to medicine.
In his free time, you'll find Dr. Jenson skiing, golfing, or even flying. Last year, the Jensons were lucky enough to go on a bucket list trip to Israel.
He's a leader, but he has a servant's heart, and you can see that in the way he does medicine.
There's a dignity that he gives to his patients. There's honor.
At 61, Dr. Jenson isn't slowing down. He's now making a run for state senator. If elected, he'll be the only physician in the Minnesota legislature.
And I get this because a couple people complained, and I don't get to know who those people are. I don't know if they're routinely in a political camp, if they're activists.
They're activists, Doc.
I've gone online and looked at what it takes to complete a complaint that the Board of Medical Practice has to follow up on. It's a one-page deal. You can say what you want. You could be a huge donor for the other party, and I wouldn't get to know it. I wouldn't get to know if you live in my district. I don't get to know anything. I checked. So here I am. I've spent the better part of the last 6 days preparing a response. I understand how important the work is that the Board of Medical Practice does. I mean, physicians do screw up. 2 of the big areas where physicians mess up is inappropriate sexual behavior. Inappropriate self-medicating, certainly with opiates. But this is an odd position for me to be in. And I am just stunned But I should have seen it coming, because I saw the threats on social media. I've seen them for the last 2 or 3 months. I've seen them come from physicians. I've seen them come from people in all walk of life. They didn't agree with me. They didn't like it, that I was trying to provide some context for the flu, for COVID-19. We've had some 35, 40,000 cases of COVID-19 in Minnesota thus far. According to the Department of Health people, that might translate into 10 times that many. And if it does translate into 10 times that many, that's 350,000 cases. But in 2018, we had more than 500,000 Minnesotans with the flu. When I say that, am I recklessly giving you advice regarding COVID-19 and the flu?
The simple fact is, Doc, the sin you committed is that you're not following the scientific dogma regarding this issue.
Dr. Anthony Fauci has come out and compared them all the time. Dr. Mike Osterholm has. In terms of the death certificates, on April 3rd, I got an email from the Department of Health that said very clearly that we should report COVID-19 on death certificates if it is assumed to have caused or contributed.
You guys remember the CDC paper that we went through and this paragraph that he just read to us, and they gave him little examples so that they could change the coding? All right.
Well, that's not how we do death certificates. The official ICD-10 coding for April 1st, 2020 through September 30th, 2020, during the time frame in question, says this: if the provider documents suspected, possible, probable, or inconclusive COVID-19, do not assign U07.1, which is COVID-19 disease. It says, assign a code explaining the reason for the encounter, such as fever, or a cough, or shortness of breath. That's what the official instructions say. So I get this on April 3rd. I end up inadvertently, sort of accidentally, running it up the flagpole with Chris Berg on April 7th. And what happens? The Department of Health, a few days later, comes out with a clarification. And then a few weeks later, they come out with another clarification. And I appreciate it. Fact of the matter is, I'm proud of the Department of Health in Minnesota for saying we are not going to list non-confirmed cases as deaths in Minnesota. We are going to put an asterisk by them, and we'll follow up on those later.
And the only reason that they're doing that is because Dr. Scott Jenson shined the light on what was going on. He's a whistleblower. Make no mistake about it.
That's not what Pennsylvania was doing. That's why they had to subtract 200 patients from their COVID-19 death count.
Yeah, we talked about that.
Colorado did the same thing.
I didn't even know that even happened.
New York went the other direction. New York said, we're having more deaths in a certain period than we normally have, so those deaths must be COVID-19. We just didn't pick them up. So never mind the testing. We're adding 3,700 to our total, and, oh, well, that does increase our total by 50%.
I've been covering this, missed it, and was hoping he was lying.
So I'm in the position where I have to explain that I wasn't spreading misinformation. And I'm not being reckless when I talk about COVID-19 and influenza both being single-stranded RNA viruses that are respiratory in nature with similar symptoms and can be spread through particulate matter and aerosol transmission. I've got an 8-page document that I put together for the Board of Medical Practice. And let me be clear. They do important work, and I'm going to fully cooperate with them. I also have some 70 pages of attachments. And in the attachments, I've got the Pennsylvania Department of Health slashing their numbers by 201. I've got the Department of Health in Illinois, where one of the directors says that just because we put COVID-19 down on the death certificate as cause of death, that doesn't mean the patient died of COVID-19.
We covered this. Let's watch it again.
Anyone who has COVID when they pass away will be included in that category. Dr. Ngozi Ezike explained this does not mean the virus caused that death, but if someone does test positive for COVID before dying, that is classified a coronavirus fatality.
You were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death.
She said that. Dr. Fauci, when he talks about influenza, he was the lead article in this New England Journal article, and he said this: if one assumes that the number of asymptomatic or minimally symptomatic cases for COVID-19 is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%.
And we covered that as well. I guess I'll provide relinks in the description.
Thus, that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza.
And here's actually everything you would need to look it up yourself if you wanted to.
That's Dr. Fauci. And, oh, by the way, one of the contributing authors was Dr. Robert Redfield, the head of the CDC.
Dr. Jensen got me. I covered this and I completely missed that.
Dr. Osterholm is a well-regarded epidemiologist. And he was saying this in the middle of March. He said, the flu has become a pandemic more than once and has killed millions of people. It still exists today. Unfortunately, we now have on our hands something else, but it's caused by coronavirus, which is acting very much like influenza. Folks, do I feel targeted? Yeah, I do. Do I know who my accusers are? No, I don't get to know. Could I be disciplined by the Board of Medical Practice? Well, sure I can. There's 2 allegations they're investigating. If I have been spreading misinformation, then what about Governor Walz and the Department of Health? Right around March 1st, we had a Department of Health memo that talked about the purpose of, if you will, some of the measures that would be taking to dampen, delay, and decrease the peak, to allow the accumulation of PPE and make sure that our hospital capacities weren't being overwhelmed. In that memo, they say what effective measures are: cover your mouth, don't go out if you have cough or fever, avoid touching your face, your eyes, or mouth, cover your mouth if you cough, wash your hands frequently, minimize outings, socially distance. But what did they say were not effective measures? They said wearing masks is not effective, taking antibiotics is not effective. A month later, Governor Walz comes out, talks about 74,000 Minnesotans dying. Later on, he went back to 29,000, and right around then, I put a different video out saying just the facts. And I said, I'm not buying 74,000 Minnesotans dying, I'm not buying 29,000. And then this one came out a month later, right around May 1st. This is a model that they're using. And it says on here, Minnesotans' model projects nearly 1,000 deaths a day in mid-July. Well, folks, that's next week.
And I looked into this. The modeling here was even worse than in the United States.
So far, we have less than, right around 1,500, of which all but 300 of them have occurred in people in long-term care facilities, in large part because the Department of Health participated in decisions that put people with active COVID-19 disease in the nursing homes.
2 episodes about the nursing home murders, not one mention of Minnesota. Sorry, guys.
And I'm spreading misinformation. Of course I am. I don't know what to tell you. I just know this is wrong. We're in a bad place. My wife asked me the other day, Scott, why did 911 pull us together as Americans so much? And why is COVID-19 breaking us apart? I think physicians are part to blame. Scientists are. We become so darn political. Physicians and scientists in the past are supposed to be above the fray. They're not. I have this odd set of hats I'm wearing because I'm the vice chair of the Health and Human Services Committee in the Senate, and I'm involved in policy discussions and involved in bills that deal with providing relief for COVID-19. And on the other hand, I've been a physician in the trenches for 35 years. So I try to connect the dots. I don't try to present myself to be something I'm not. I'm not an epidemiologist, but yes, I've taken epidemiology classes. I'm not an infectious disease doctor, but I take care of infectious disease every day. I just want to leave you with a couple of questions you could maybe ask yourself. Do we think it's okay for physicians to certify on death certificates that someone died of COVID-19, even if there was never a COVID-19 positive test obtained, even if there was never a COVID-19 test done, even if a COVID-19 test hadn't even been considered? And maybe the worst even if the family had no clue that the death certificate they received for their loved one was going to say COVID-19. What do we want to be doing there? In Minnesota, I think the Department of Health is taking care of business. Those are important questions. I'm sure there are naysayers out there that think that I'm getting exactly what I deserve. Fine. If it can happen to me, I think, frankly, that it could happen to anybody. It feels ugly. It feels like some of the people that disagree with me don't want to have a conversation. I've asked many of you to have conversations, and you've not been interested.
Yeah, welcome to cancel culture, Doc. They don't want to debate. They just want to cancel.
So, reckless advice regarding comparisons between COVID-19 and the flu. Spreading misinformation because I cried foul when I received a memorandum from the Department of Health on April 3rd, which directed me to a CDC link, which says clearly that you could have a patient suffering from other medical problems, wheelchair bound, severe stroke within the preceding year or two, no COVID-19 test ever done or ordered, and when that patient dies of pneumonia, it's a COVID-19 death. I cried foul. And I'm grateful that the Department of Health, a week later, tried to clarify things, and a month later clarified it further. But I'll say it again. The official people who write the coding Bible in this country said, if the provider documents suspected, possible, probable, or inconclusive, do not assign COVID-19. Thanks for listening. We better all stay engaged.
You guys, I'll provide as much linking as I can in the comment section below. Try to find Senator Dr. Scott Jenson. Try to support him. Do it vocally. Do it on social media. Do it to your friends. People need to know that this stuff is happening. We can't let this happen in our country. If we can't let our doctors debate the science of medicine openly, then we are not going to get healthy medicine. Anyways, guys, like, share, subscribe to the channel. I'll talk to you later. Hopefully, we'll have some good news soon.